Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart? Today we have Dr. T J Pradeep Kumar, MD Cardio, Physician, Brookfield Hospital, Bangalore.
How do we define hypertension and when should we conclude that the person has hypertension?
So hypertension is defined based on the age of an individual and the presence or absence of comorbidities. Any person who is above the age of 18 years and who is having a blood pressure of more than 140/90, systolic blood pressure of 140 and a diastolic blood pressure of more than 90 on two different occasions, on two different settings, 1 week apart. These people are the ones who are diagnosed to have hypertension. With the presence of some comorbidities like diabetes, their cutoff mark is lesser, which is 130/85. We should also understand that when a person is taking medications, this blood pressures become irrelevant because those blood pressures are under control only because of their regular medications. Hence, we need to be careful whenever we make the diagnosis. It needs to be supplemented with certain investigations, and to get a more accurate diagnosis, we use a parameter which is called as a 24-hour ambulatory blood pressure monitor, which is more diagnostic for diagnosing a newly detected hypertension.
Can high blood pressure be completely cured?
Hypertension is a lifestyle mediated disorder, and as it is a condition, it is essentially controlled and it is not referred to as cured. It will be under control as long as you continue to take medications. The minute you stop your medications, it is bound to rise. So this is a condition that can be under control with medications but cannot be cured permanently. But there are certain hypertensions which are called a secondary hypertension, where there is a known cause for a certain in certain disorders, and if we treat the cause, then blood pressure can be treated once and for all. So they are known as secondary hypertensions, whereas primary hypertensions are ones that needs to be treated lifelong with medications.
Has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
Right. So most of us must be aware of these newer incidents of younger people succumbing to heart attacks, younger people succumbing to cardiac arrests when they're working out in the gym, when they're working out in a park, and those kind of situations. Gone were the days when we were actually seeing hypertension only in the 4th decade, 5th decade or 6th decade. But nowadays we start seeing blood pressure at very young age group, as early as 20s, 30s and 40s. And that is essentially as a result of their faulty lifestyle and unhealthy diet. There is a sedentary lifestyle, and there's a lot of stress. And all these things leads on to a combination and a heady cocktail which predisposes them to develop hypertension at younger ages. And then higher incidence of this population having these kind of a sedentary lifestyle and lack of exercises, poor diet, has resulted in more and more people developing this.
Thank you, doctor, for your time.